Hey everybody, it's Kristen Wilson from Action Potential Physical Therapy. Really excited for this presentation with Dr. Paul Yerkes from Core Family Practice. We've been really pumped to get to know their practice, both Dr. Ricky Haug and Paul Yerkes, and now a brand new doctor, Brianne Robson, and she is helping them kind of get their Glen Mills office up and running. So really excited, Paul, to have you with us today to kind of talk about a topic that we find a lot of people are like, what the heck is that all about? So today is all about being direct. We're going to demystify two elements of healthcare that people are like, I don't even understand what that means. And I thought this would be a really fun opportunity for us to do that.
Awesome. No, thank you so much for having us. And yeah, we get that question a lot too of this is a totally different concept and way to get healthcare. So I think it's great to get it out and walk through it.
Awesome. So, I'll go right with the question, because this is the question we get from our patients that are, when we refer over to you and say, like, we love these guys, they're a direct primary care practice. And they're like, well, what's direct primary care mean? So go for it.
Absolutely. Yeah. So direct primary care is a newer model of healthcare, which kind of harkens back to the way healthcare and medicine was practiced back in the day, where you had a personal physician that you were directly contracted with. In our model, we've stepped outside of insurance. So we don't require any insurance whatsoever. We don't bill an insurance company. And the reason we do that is because it allows us to work for the patient and not for the insurance company. It allows us to have smaller patient panels. Instead of 2,000 to 3,000 patients on one doctor's panel, we have a maximum of about 600 per doctor. In addition to that, it allows us to have longer visits. Our initial visits are about 60 minutes, follow-ups of 30 minutes, and really allows us to dive deeper into patients' problems. That allows us to then limit the amount of urgent care, ER visits, specialist visits that are required, because we're able to handle more. In addition to that, all of our patients have better access to us. We have same or next day sick visits, and we're also able to allow them to text us after hours on evenings and weekends. Again, all the idea of having a direct contract with your doctor. So that's kind of the fundamental part of it. We operate on a monthly membership. It currently is $78 per patient, and there's no other charge. Patients can come in every single day if they wanted to. Essentially, I always look at it that I'm probably not doing my job if that's the case, or they, it could be monthly. There's no additional charge for visits. Any procedures we do in the office, suturing, biopsies, small skin procedures, pap smears, the procedure itself is completely covered, EKGs, strep testing, things like that. And we really believe in having this transparent model of cost for anything in our practice. So that's kind of the gist of what direct primary care is, and particularly our practice.
Well, and speaking from experience and knowing both how, the two of you and now three of you practice, I think, you hit on two really key characteristics that I want to just reiterate, because I think they're so important. One is the connection with the doctor. There is no medical provider that spends 60 minutes with a patient on their initial visit. And, we always laugh. We have patients come in for PT and they're like, oh yeah, the nurse saw me for 15 minutes and the doctor saw me for 15 seconds. And it was, they were looking at their computer the whole time, taking notes. Yep. So, I think that that's so important. Tell me a little bit about how you feel that leads to being able to provide better medical care for them.
Absolutely. Yeah. So, especially we tend to get patients who maybe have, we get all spectrums of patients, but the area where it really comes in advantage is when we have a very complex patient who maybe has a lot of medical problems or haven't found the answer to some of the questions that they've had. And being able to dive down into the entire history with them, as well as being able to have the time for me, if I'm not skilled in one particular area, having the time to either reach out to specialists and ask their opinion, or to do research on my own, it allows us, rather than just reflexively saying you got to go to the specialist and get an answer, to take more of an ownership of that patient. In addition, having these longer visits and smaller patient panels, I get to know my patients better. So if a patient calls me and I've known them for 2 years and they're saying, Doc, I'm really worried about something, and I don't normally hear from them that often, I'm going to be a little more worried and say, let's get this person in ASAP. So that doctor-patient relationship is so much more strengthened when you have the time to foster it, and it really plays into overall care of the patient.
Well, and I mean, isn't that the best part? It puts care in medical care. Like, oh, that's a really neat idea. Yeah.
Exactly. Yep.
And the other part that I want to highlight is the transparency, the price transparency. And for anyone who is using their healthcare, accepting healthcare, dealing in the healthcare industry, we know that this is a huge frustration because, a lot of the plans right now are high deductible plans. You go to a practitioner, you get a bill, and that falls on your lap and you're like, boy, I didn't even know this is what this was going to cost. So the idea of that transparency as well as that accessibility to be able to go and say, hey, I'm not limited by a certain number of visits, or I don't have to worry about this high deductible issue, I think must be such a relief for a lot of your patients.
Oh, absolutely. And the nice part about our practice is we've negotiated a lot of cash rates for patients. So even if they have insurance, there's a little known rule in the HIPAA law that says that they do not have to use their insurance for any medical procedure, test, or even visit. So what some of our high deductible patients will do is they'll ask us what the cash rate is. And a perfect example of this is in my own life. My wife was pregnant last year. She went for a echocardiogram, an ultrasound of her heart. And the OBGYN sent her downstairs at the facility, and she went because she was worried. And they charged our insurance, I think, $2,200 for that. And our out-of-pocket cost was $500, which obviously not $2,200. I can get that cash for $120. So it's like a perfect example of like, hold on, if we take kind of a step back and can play with this, and not always can we save people money, but we do try to navigate the cost aspect of it. So when it comes to insurance and being able to look at how you get your health care, it's nice because we're outside of it, so it doesn't matter to us. It's whatever a patient's comfortable with, but we can then help them with whatever plan they do have.
Yeah, absolutely. Kind of transitioning off of direct primary care into another kind of version of accessibility, on the physical therapy side, the direct word that people don't understand for us is direct access. And so, patients will call and we'll say, oh, do you know you can come for direct access? And they're like, what the heck does that mean? And really what it means is that in any state in the United States, you can go to a physical therapist directly without seeing a medical physician prior to write a prescription or write a referral. And this is something that the American Physical Therapy Association has worked really hard for providers to be able to do with the inception of the doctorate degree for physical therapy. So that was kind of the catalyst was, hey, let's broaden the education of the physical therapist, include some things on pharmacology and imaging so that now the average physical therapist understands what are the signs and symptoms that would require, having either imaging or pharmacological management. So, in the state of Pennsylvania, every state has its own laws for how direct access is utilized. Currently in the state of Pennsylvania, any patient can come to physical therapy without a doctor's referral or prescription for up to 30 calendar days. Now, the thing that I always like to say up front, and certainly working with great doctors like Dr. Yerkes and Dr. Haug, we are very well versed in knowing what's outside of our wheelhouse in physical therapists. And by nature, physical therapists tend to be very conservative. So if there's anything where I'm like, I don't feel like that's 100% in my wheelhouse, that's when I would reach out to a physician anyway to say, I need another set of opinion on this, or maybe it's a phone call or whatever the case is. So I'd like to say that to alleviate people's worries who are used to using the physician as the gatekeeper to physical therapy. Really to just reinforce kind of what we mentioned before, that collaboration of care and being able to work together with other providers so that our patients are getting the best care that they can. Once that 30 days is up, then we do have to work with a local physician, whether it's primary care or a specialist or an urgent care doc, to review the case and have them sign off to say, yes, I'm going to approve this person to receive care beyond the 30 days. The only population that this is not true for in Pennsylvania is the Medicare population, because Medicare has a sub rule that says they will only reimburse for care that is under the care of a physician. So you can come to a physical therapist with Medicare to be treated. However, your Medicare insurance will not pay for that unless a physician is on board. So, I bring this up because people don't know that they can go directly to a PT if they sprain their ankle or they tweak their back. Instead, they're making appointments for specialists or their primary care docs months out, weeks out, and suffering that whole time. And really, like you said, Paul, we can get you in within a couple of days or a day of if it's emergent, to help you get some relief to manage those symptoms. And again, if it's outside of our wheelhouse, then we work with a physician to manage how to do that.
I was going to say that it's a perfect example of kind of a no-brainer type of medicine, right? Is like you said, especially if you have a chronic condition or something, I tweaked it. PT is you don't need to make an appointment with a doctor at that point. It's if there's no red flag symptoms, which you guys would absolutely be able to triage. That's what I would want. I would want you to get in as soon as possible. We know the quicker you get into physical therapy, the better the outcomes are. So, and if things don't get better, that's when you come and see me. So, we're obviously very accessible getting people in same or next day, but a lot of times I see patients wait, like you said, 2 to 3 weeks, and they're suffering through this pain just to see a doctor, for the doctor to go, great, yeah, go to PT. I mean, it is mind-boggling. So,
or the counter is the doctor puts them on opioids.
Well, yes.
or prescribes them an MRI, which is going to cost them $5,000 on their high deductible plan. So there's definitely ways, when we come back to that whole idea of transparency, quality of care, there's ways that we can manage this. And under no circumstance am I ever saying that there is no need for physicians to be involved with physical therapy. Of course there is. But again, you're looking for providers that are going to have that communication. They're going to triage the situation and use their relationships to provide you with the best care. And I think that that's so important in today's medical model, because that gets overlooked on a regular basis.
Absolutely. No, absolutely. Couldn't say enough.
And just to kind of close out today's chat, I love encouraging and empowering people to find providers that they feel comfortable with, that are demonstrating these types of principles, which is why we love, working with you guys. Like, we want to know that our patients are in the best care possible, the best hands possible. And I know if I have an issue about a patient, I can text you, Paul, and you'll write right back to me, and we collaborate. That goes far beyond even physical therapy. Your cardiologist and your GP should be talking to make sure that the meds are being watched.
Right. Yep.
And I think that that's such a part that's overlooked in medicine. And I'd be curious your thoughts on that, Paul.
No, I think that's the why we have such a strong relationship with Action Potential in particular, is because the physical therapists there are so hands-on, and not hands-on in the sense just during the visit, but also in reaching back out to us to say, hey, do you mind giving me a call real quick? Can we talk about this patient? Because I want that feedback. I mean, there's parts of the exam, or when you're working with a patient in PT, that it can give me more evidence to then say, all right, I need to start thinking about maybe a different pathology, or maybe we need to go a different route with this. And so it's so important to have that open communication. We look at ourselves in primary care. What it's supposed to be is that we're kind of the quarterback for patients, so that we when you're at a cardiologist, I might have you go see a cardiologist, but we need to make sure pulmonology is aware of what cardiology is doing, and same thing with PT and ortho, and to have everyone on the same page. So to be that kind of quarterback for the healthcare, I think it's so important to have those open lines of communication. It really does facilitate the best kind of healthcare.
Yeah, absolutely. And whether you're a client of one of ours, Core or Action Potential, or not at all, I just encourage people to really just be proactive about those relationships that you're choosing, and choose really good providers, because they are out there, they can be found. And obviously, we particularly want to make sure that our community is happy and safe and healthy. And the best way to do that is by finding those great providers. So Paul, thank you so much. I appreciate you sharing your thoughts on direct primary care. I think it's an incredible model, and I'm so thrilled that we've been able to connect. And now that our offices are in both of the same towns, like it's just wonderful.
Absolutely. It's great. Yep.
Yeah. Fabulous. If anyone is interested in reaching out to learn more about either direct access or direct primary care, we're going to put a slide at the end with the contact information. I know at Core, there's a free consultation or free meet and greet. Is that right?
Yep, absolutely.
And we also do free consultations, both virtually and in person. So, all that information will be at the end of the video. And of course, if there's any questions, reach out. We're happy to shoot an email back and answer any questions. Thank you so much for your time today, Paul. Really appreciate being with you.
Thank you so much for the opportunity, Kristen.
Take care.
Take care.